1 or 2, somewhere around there. And I hear that the commissioners are in a closed door meeting at the moment, so they won't be joining us at this point. I don't think. Mackenzie, they're not going to join us, are they?
Oh, they are. They're just in executive session right now, but they are wrapping it up. We just gotta.
Yeah, because we can't really do any action.
Right.
without-
So we will put off item 2 and 3. And since we've got folks in here, why don't we do some introductions real quick? I'm Darren Moody.
Oh, hold on. I don't have anything on you. Oh my gosh.
I thought you said you started it.
Well, no, I turned the Zoom on. I just didn't start.
Well, I just figured you were super efficient. Go ahead.
You're being way too efficient.
Okay.
Which I appreciate.
Well, I just came from the hospital meeting, so I go from one to the next.
That's right. So just at the end, when we do the approval of minutes, you'll have to sign it.
Okay. And there, we just said, she said we're wrapping it up.
Trying to.
Yeah.
Sorry.
And Rachel's here?
You.
I am.
Excellent.
Is Randy on with you?
Yeah.
I started the meeting and then I got told I should have started, so we stopped the meeting.
We haven't approved them yet.
You can tear it up.
It's at the hospital, I'm meeting, I'm freezing my butt off in the meeting. I get over here. I'm like,
It's like my office, in the morning it's freezing, and by afternoon it's 84, 85 in there. And
get the extra clothes
Yeah.
up.
get the fans going, but just need hot air around.
That's scary. Are you?
Living the dream, or somebody's.
Just got a 40-minute call with
It's
Gina.
Tuesday, all day meetings.
You may want to wait to sign that because we haven't approved it. You may want to go ahead and sign it.
You can tear them up if you didn't approve them.
Okay.
He arrived. All right, Mackenzie, we ready?
We are good.
All right. We'll call it at 11:04. We'll start the meeting again. We'll do some introductions since there's folks in the room that we don't know, obviously. I'm Darren Moody.
Eric Nisco?
Peggy Van Busker.
Pat Parslow.
Sharon Trask.
Randy Neville?
Dave Wyndham?
We'll start down here.
Christina Miller-Finn, Mason County Public Health. Melissa Casey.
Ian Tracy in Arundel.
I'm Dan Nelson with the Olympic Region Clean Air Agency.
My name is Jeff Johnston with the Olympic Region Clean Air Agency.
Odell Hadley with the same name.
And Mike Schultz with the same agency.
Is there anybody in the office today? Okay. Now that we have everybody seated, let's go to item 2, approval of agenda. If we've all had a chance to look at it, is there any discussions or issues with the agenda as presented?
I'd make a motion to approve the agenda as presented.
Second?
All those in favor?
Aye.
Agenda has been approved. The minutes for March 25th, 2025. If you've had a chance to look at those, is there any adjustments or changes to those minutes?
I move that we approve the minutes for March 2025.
I'll second that.
All those in favor?
Aye.
Here we go. Health Officer Report.
I don't see him online.
Go for it. Oh, sorry.
He had something he wanted to talk about, but he's not here, so I guess I'll move on to the next item.
All right. Administration Report, FPHS Finance and Budgeting Process.
Okay, so FPHS, Foundation Public Health Services, is a section of our funding that we started working on in 2011, ran it through the legislature when I was chair in 2019. And basically, if you take all the things public health can do and you compress them to things that we have to do, so what we're required to do by law, what's population-based, and what we're funded to do that other people aren't, like epidemiology, for example. That's foundational public health. And it's a significant part of our funding. It's about $2.1 million. The process that it goes through is it comes from the legislature. So the legislature tells us what they're going to contribute to the system, and then it goes to the Public Health, the Foundation Public Health Steering Committee, FHS Steering Committee, and that's made up of Department of Health, local public health jurisdictions, State Board of Health, and tribes. And that group decides how the money is allocated and what programs it's allocated. So some of it is just straight flexible funding that goes out, my choice how to spend it. Others is more categorical. We've tried to stay away from categorical, but it seems to keep creeping back in. So this year, once they decide how it's split up, Department of Health and local health jurisdictions have to have concurrence, both sign off on it, or nobody gets the money. So that's something we put into law back in 2019 to force local health jurisdictions and Department of Health to work together. So, and it's worked very well. It's led to some grumpy conversations, but we get there and move forward. This year, the legislature said we're going to cut $12 million a year from FPHS. Now that's for the whole system of public health, that's $324 million. So it's going to go down to, over the biennium, it's going to go down to $300 million, $12 million a year. So we're going into the steering committee, and they just met Thursday, and I just got off the phone with them 20 minutes ago. Going into it with an eye of taking that cut, maintaining the tribes whole, maintain state board health whole. DOH takes $6 million, local health jurisdictions takes $6 million in cuts across the system. And we voted on that about 2 weeks ago through ELK. I'm the chair of the Executive Leadership Committee, and that's all of the directors and administrators. And we said, well, tell us just what the number is, and we'll figure it out. We'll figure out how to, make the cuts, shave a little here, there, and then come up with our piece per county. When we made that recommendation, the steering committee came back and said, well, we're not going to go that way. We're going to determine which programs get cut on a system-wide basis. And I just got clarification on that just 20 minutes ago. So we have another meeting this afternoon, and I'm going to push back on that. I have a difficulty with the steering committee telling me what my priorities should be. That's this board's position to tell me what my priorities are supposed to be, and which programs to push forward and which ones to drop. I think any good administrator.
All the counties?
Yes, so all 35 counties, 35 jurisdictions. There's 39 counties, 35 health jurisdictions, because some are multiple jurisdictions. Northeast Tribe, Schlein Douglas. We asked for us, just tell us what you want us to cut, we'll figure it out. And that's just not the direction that they're looking to go. So we're meeting again this afternoon. We're pushing back on that again. I just don't think that's the appropriate way to go with it. And I have had conversations with other health jurisdictions Friday and this morning as well to talk about how we actually do it. The problem I have with the way they're setting it up, so for example, if they say, we want you to cut hepatitis C because you haven't spent your hepatitis C money. Well, it's not a problem of us not wanting to spend it, but we haven't been able to hire for it because you have to hire an ARNP to do it. So we didn't spend it this year, so I sent it back. And if you take it out of my budget, then I can't come back to this group and say, all right, I still want to put that position in because that position opens doors for other things that we want to do because it's not in the budget. And they said, well, you can ask for it back. I said, that's the wrong approach. I don't want to have to go back and ask for it again. So nothing is set in stone yet. And again, we have to have concurrence in order for this whole process to move forward. So between now and the end of June, it's going to be a rollicking good time determining who gets what and who gets cut and how it looks. For us, 6% is going to be 149,000 in total. If they just give it to us as a chunk. If they take it by program, I'm not sure what that's going to look like. They may say, as a statewide system, we're going to stop X program. So we'll just kind of have to see where that goes. But for the next month, it's kind of up in the air as to what that's actually gonna look like down at the county level. So one of the things that I proposed was, when we first got our funding, our first set of funding was $8 million. So we funded the things that were most important first. And then with the next chunk of money, next down the line, my proposal was last in is first out. The things we funded last, we determined were the least important. Let's take that off the plate first if we're going to do it categorically. So that's the conversation this afternoon.
We also have to debate bodies versus position, or bodies versus programs.
Right, and I mentioned that, just look, I said, when you look at it, you're looking at dollars, I'm looking at people. And
That's a body.
that's a body, yeah. About a body and a half. So I said, let me figure it out, but we're gonna go through the process, and I'm not sure where we'll land. But we are having the discussion, so I just wanted the board to know that this is complicated, and it's gonna take a little bit. It puts us kinda in the same place we were in 2017. We went through the same process, had the same kind of issues. 2017, we had budget reductions, and we didn't get our contracts signed around until the end of August. They should have been done the 1st of July.
So this could be a few months.
It could be a few months.
Another argument for cutting programs would be what's important in Seattle may not be important in Mason County. What's important in Mason County might not be important in Seattle. So that's kind of where the cutting programs might be a problem.
That's pretty much a guarantee.
Yeah.
Seattle might have been a bad example, but.
Exactly, so I mean, you've got, Garfield is gonna look different than Mason County, it's gonna look different than Wahkiakum, it's just so broad, how do you do that and somebody not come out on the short end of things? So, I just wanted the board to know, it's gonna be tough, and as I hear things, I will continue to put them out to the Board of Health, so you're up to date on where we're going. So I will know more this afternoon. And what I may come back and ask for is a letter of what our board would like to see happen. But we'll have more conversations this afternoon, and then I can send out an email and say, this is what we're looking at, what's the board's pleasure?
So, should we just go ahead and do that ahead of time? If we're in agreement on the idea.
We could do that, and I'm okay with that.
Well, because we don't really meet again
Right.
for 2 months.
That's what I mean, and we can always e-sign it or come in and sign it and write off on it or what that, but I would think right now is the time to do it because we're talking about it rather than at the last minute when you come back and go, crap, now I need the letter. I'm sorry,
Well-
not crap.
I could draft up something just saying, our preference is to have a fixed amount, and we'll cut programs as appropriate to the goals and strategies of the Board of Health.
With the dollar amount that
With
they
the dollar
need to
amount,
cut.
yeah. Mhm.
Do I hear a motion?
So moved.
Second.
All those in favor of a letter supporting Dave's idea? There we go.
Okay,
Now you got your letter done.
and I'll go
Did you
write
get
it.
that motion?
Dave's idea. That's what we call the motion. You can clean up all of our stuff.
More local control.
Yeah,
There you go.
yeah, and flexible, that's the key to making this thing work. So, all right, that's what I had.
Okay. Community health report, Melissa.
Oh, already, we're going through the agenda really quickly. Good morning. I have my regular packet report attached, but there's one particular item that I'd really like to kind of highlight today, and that's in regards to our home service program expansion. Some of you may recall back in October of 2024, I think we had a special meeting. We brought forward an expansion proposal to take our syndemic clinical services and syringe service program a little bit more mobile. We have developed really robust policies and procedures around how that's actually going to be implemented. We worked very closely with the county prosecutor and with risk management. And ultimately, I think the board was in approval of that at the time, brought that forward to the Board of County Commissioners, who also approved it. But now, fast forward several months, again, we talked about this in October. There was a lot of things that really kind of delayed our ability to actually implement it as planned. Dave mentioned earlier, you know, the inability to hire a provider. We do need an ARNP, an Advanced Registered Nurse Practitioner, or a PAC, which is, I think, a Physician's Assistant Certified. Is that correct? And, you know, because of the funding climate, we took a little bit of a pause on both purchasing a new vehicle as well as posting that position, just because there was a lot of things that were really unknown at the time. We wanted to be a little bit more conservative in planning an expansion, just because if we expand something and then funding gets cut, we have to scale back again, and now we have a gap in services. We did actually receive $35,000 dedicated specifically for the purchase of a vehicle to actually use for the home service expansion. And we do have to spend that by June 30th, so now we're kind of in a position where we have to spend money very quickly. But we've worked very closely with Jen Byerly, the county budget manager, I think that's her title, to put together a resolution which, if this board doesn't have any questions or, you know, opposition to it, will be coming to the Board of County Commissioners for approval in the next week. But we wanted to just talk about kind of a little bit of background on what this looked like. In the interim, because we also had an obligation to provide these services regardless of having a dedicated vehicle, we have partnered with North Mason Regional Fire Authority over the last month and a half.
2 months?
2 months. And so they've sent down their provider. They have a PA. Is Adam a PA?
Yeah.
They sent down their PA as well as 2 registered nurses to come do the syndemic clinical services in downtown Shelton with Christina. I don't know if you want to talk very briefly about what that's looked like.
Yeah, so to get things off the board, I know we were really eager to get things going, and it's not robust to what the full plan will be, but it's something starting. So we're working with the Mobile Integrated Health Program as well, their North Mason staff as well as some of their Central and South Mason staff to start a weekly infectious disease and wound care clinic. So we've been doing infectious disease testing, HIV, hepatitis C, and STIs, specifically syphilis, gonorrhea, and chlamydia. Because the Mobile Integrated Health Program has more of a holistic model, we are taking that approach right now, so each patient gets kind of a full workup. We're looking for people with a history of drug use or maybe risky sexual behavior, people who are not engaged with medical services yet, so do not have a doctor, and we're doing these testing events. So we're able to, within the first initial visit, do a blood draw and kind of a general workup. So they're doing EKGs, they're doing blood pressure, temperature, etc. A urine test to see if there's, you know, proteins or other signs of infection, and then wound care, any other issues that they might need. And then when they get back, when they come back for their results in a week, so the next week, if they test positive for anything, because they've already done that full lab workup for the initial visit, we're able to prescribe treatment if it's an eligible case. So we've done 2 hepatitis C treatments have started already. One, we're waiting for this person. There's some other medical issues, but we're waiting for this person to be well enough. So we'll basically have 3 hepatitis C treatments within the first 2 months, which is pretty incredible. And we're finding a few other high-risk STIs as well. Our main goal also is to get people involved in primary care. We are not primary care, we're not trying to do that. So we actually have the intake paperwork for Peninsula Community Health Services, our federally qualified health clinic. So if that's something that the patient wants to pursue, they can do their paperwork, their intake paperwork while they're with us sitting, so it's a big packet, and that's, we know, a barrier. A lot of people don't take that first step, so we can help them with that and get them connected right into care for follow-ups. Right now it is only 1 day a week in Shelton. We are able to make some appointments as needed for North Mason folks, so if somebody's in Belfair or Tahuya, we can use the fire headquarters, the fire station, to do some work there. And yeah, the expansion with the vehicle, we'll be able to do what we originally did, is go around the county and meet people where they're at to get the really the folks with mobility issues, transportation issues in our rural kind of pockets of the county. So Tahuya specifically, maybe the Hood Sport kind of area, Matlock, maybe some Harsine Island. So we're very excited about that. And like I said, or Melissa said, we have the funding, $35,000 to purchase a vehicle. This is a one-time funding from some extra money, so it's not something we can expect, to get again. But we are fortunate that we have some funding, and we're secured in funding for our grants for at least another year until summer of 2026.
Thank you. So, are there any questions about that?
This isn't the motorhome we talked about before.
This is gonna
No,
be a minivan.
no, that's on pause for now.
This is gonna be a minivan.
I was going 35,000, it's not gonna
No,
cover
no,
that.
no.
The larger the vehicle, I think a mobile clinic is definitely something that would be in the far future, dependent on what funding looks like. Now is not really the time to do an expansion like that. So Christina and I went and looked at some minivans. At this point, it's probably looking to be a Chrysler Pacifica, because they were the only model where you can reconfigure the inside of the van and kind of set it up depending on what type of visit you're doing. I think in the Board of Health report for community health, there is a little bit of a breakdown of what kinds of services have been offered so far. 13 total infectious disease tests, so that would include, I think, is that the finger stick?
No, we're doing the full
The
blood
full
draw.
blood draw.
We're not even doing finger sticks right now.
2 wound care sessions, and then other things. We don't want to forget that, again, this is an opportunity to engage this population. It looks like there's also been opportunities to get people engaged with detox if that's a service that they needed. There hasn't been any MOUD, which is medications for opioid use disorder, initiated yet. But that's also another goal of this program. Overall, 29 clinical engagements. And as you can see, there's just a variety of services that are offered. So the ability to reconfigure the van, include all of the clinical service supplies, the wound care supplies, the butterfly needles that are needed for the blood draws. The ability to store that in the van was definitely something that we were looking for. And finally, in discussing this with North Mason Regional Fire Authority and their mobile integrated health program, initially we had only done a pilot to kind of get us through this current program year, but spoke with the chief, or we played phone tag, he left me a message last week, and it seems like it's something that even the staff at North Mason are really excited about. So I think that there's also opportunities to continue partnering with them as well, to really kind of continue to expand our reach and provide holistic services around the county. Any questions or concerns?
So the vehicle,
Mhm.
Have you talked to Jen about the motor pool
Yes.
and maybe
We have. We've looked
in
at
the enterprise?
Yeah, we've looked at different options, so whether we get it through Enterprise, it looks like right now the best option is to purchase, I don't have the resolution with me, is to purchase it using the funds that we have available, the $35,000, and then we can incorporate it into the Enterprise so that for any of the, like the gas card or the maintenance costs will be rolled into the county, and I don't know how that gets rolled into our budget, Dave, but it will be included, I think, probably in our department motor pool costs.
So is this a van is it gonna keep its value, or, cause I'm wondering.
Well, the
Because
upfit and everything would
right.
change everything.
Well, there's no upfit really.
You're just
So it's
gonna have a van?
For what?
Yeah, this is not a clinical van, it's not like the one we talked about last year.
Just a transportation
Yeah.
van,
Yeah,
This
it's,
basically?
Transportation and storage, it sounds
Right.
like.
This is the vehicle for the home service expansion that was voted and approved last year.
Mhm.
So it's not replacing the RV right now and, perhaps the mobile clinic later down the road. This is the vehicle for us just to do the home service expansion to drive around. So right now, Public Health has 2 sedans, which do not have the ability to hold enough supplies or really have people come in. So we were looking at different models and thought a minivan would be a great, vehicle, because you have the bench seats in the back. So if somebody wants to come in for private conversations or for perhaps like antibody infectious disease finger stick, not the full lab draw, but a little thing, or want to talk about treatment, make phone calls for detox, or, because that's one of the things we do a lot when we're talking with people is, you know, we always say, do you want referrals for treatment, medical or dental? And if they say yes, we say, how ready are you? Do you want to make phone calls right now? So we need a private place to do that. And if we were doing the home service expansion, if we were not in a home, or we were maybe not in a home where somebody wants to talk about private matters, we could have a place for them to come in the back of the van, but it would still be large enough for us to store enough supplies while we're kind of doing our route.
Having a hard time visualizing
Well,
it.
I'm having a hard time equating the cost and everything for what we're doing. We have enterprise for the White Fleet. And, if we're not doing an upfit, then why are we not going through what we already use and do?
It's not big enough.
There weren't any minivans.
No, I mean, but we have White Fleet rental,
Right, but
which could be a van, just as easy as it could anything else.
I'm not sure.
We did a cost benefit analysis with that, so using Enterprise, using the system we currently have, Enterprise would have to purchase a brand new vehicle. So they would go to the manufacturer, they would make a vehicle for us, there would be at least a 6-month lag time. We don't need a brand new 2025 vehicle, but that was one of their options. The other option was we could go through them to find a vehicle that was already in a lot. They didn't have any minivans, they don't have anything in their current catalog for us to use. So I talked to Maddox, our enterprise rep, Jen connected me with him. So he sent us the paper, we've done all of the cost benefit analysis. So we've looked at the cost of how much it would be to rent a vehicle, to lease a vehicle for a year. And that would be more, it would take, we would surpass the price, I believe, I don't have the paper in front of me. In about 4 years, we would be past the price of a new vehicle.
With the agreement we have with Enterprise, after it reaches a certain mileage, after it reaches a certain use, they keep track of everything, and when it becomes an equilibrium of value and stuff, they move it and bring on a new one.
Yeah.
So you almost can't do the same cost analysis because there's a different provision in how we handle our White Fleet. Just keep that in mind. I'm not saying no, I'm just telling you that's something we need to pay attention.
That funding may not be available then. So what we're saying is we have a chunk now, and there's no provisions, I know that it's going to be a second chunk on that, 4 years down the road or whatever, so.
Well, I would assume, based on the size of the county where you're talking about servicing, in 4 years, you're gonna need a new one anyway.
Yeah.
We did work with them to do the cost benefits. We were working with Enterprise for this comparison, which was also required by the state and I think by the county. So we already followed that process of looking at different models and doing that. The other thing is if, again, leasing it, we would have to be putting $12,000 to $15,000 in the budget every year for the next few years to allocate for that vehicle. Whereas again, it's a one-time purchase right now. We have the funds, we wrote a grant for it, we have the money for it. We can do that now, and then we wouldn't have to put leasing costs in the budget. We would maintain the maintenance costs, the maintenance and
I'd
repair
say, and I'm not
costs in the
standing against it,
budget.
but I tell you, we did, that's why we shifted, because when we owned it and we have ownership, there's a lot of other things that come along with it that we don't deal with when we have lease. But again, I'm not standing against it. Huh? That's right.
Green cars anymore.
We literally,
Wasn't because there was paint.
doesn't mean we
Well,
can't
yeah.
take on a new one, 'cause I think we still have a few vehicles that are still, not
On the old
underneath
ER
our
in our
contract.
system.
Yeah, still alive barely, though, there's only a few of them that are still out there. You've sat down, you've also, I assume, worked it with Kelly Frazier,
Yes.
cause he's gonna be the one that has
Yeah.
to fix it and take care of it. Okay.
We've done all of the things that we think, one, were required. We worked again with the county to make sure that we were in alignment with the county's policies and procedures. We were in approval. Jen helped us make the resolution to be able to do this. And I think financially and long-term, this just seemed like the most prudent choice and the most pragmatic choice for what we needed, especially considering the inventory that Enterprise had available and the time it would take to go through them.
So you said the money is you have to spend it by the end of June?
Yeah, it just came out in the last amendment.
So you're gonna have to, do you have the resolution here?
Not with me.
We put it in the, to be put in the
Because
packet.
my only, my only
Does it
concern
have to
is
go
that
through
this
us,
board
then
has to,
then the
right, this
county?
board has to approve it, and then it has to go before the commissioners.
So this body approved it last fall,
Mhm.
and so now we just need to take it to the commission for the actual
Is it a
purchase
different
piece.
resolution?
It's the same
It's
thing.
the same resolution?
Yeah, same resolution, yeah.
Okay, that's where I was confused.
So it's already been through the process, we just haven't got.
Right, we just need to take it to the county now and get it signed off that we've checked all the boxes.
All right,
Any other questions? Okay.
Hey, Ian,
All right, good morning, board members. I just have, usual report, and then, does anyone have any questions about the report? Questions? And then if anyone does, I'm happy to discuss. And then, the second item I have is a renewal for the onsite student advisory committee. Peggy had, noticed that the applicant had checked that it's a question of like a combination Mason County citizens / citizen of the United States. I don't know why that question combines those two things, because they're very different. But this is a contractor who's lived and worked in Mason County for his entire life. He's been here for a very, very long time. Near his previous appointment, he had moved to Thurston County, and the board had approved him then, so nothing has changed. He's still a contractor in Mason County. He's on the Olympia Home Builders Association, which is our nearest builders association we have. And he's applying for renewal to maintain his current service on the board. On the sorry.
But he no longer lives in Mason County.
But he no longer lives in Mason County.
But
But
he
that's,
is
but
a
that's-
US citizen.
Yes, he is a US citizen. He no longer lives in Mason County, but he also was not a Mason County resident when he was approved the first time.
So I would make a motion that we approve him to continue on that board.
I'll
It
second.
is, oh, yeah, it is one of the ones that's more difficult to keep filled.
Yes.
Yeah, we have no competing applications for this position.
can you repeat the position one more time for notes?
This is the On-Site Sewage Advisory Committee, and this is the Home Builders Association representative position that he currently holds.
And had a first and a second, all those in favor?
Aye.
So moved.
That's all I've got for you.
That's the shortest report you've had.
I know.
Although it's very long in the packet.
Yeah. Okay, Clean Air Agency, Orca presentation.
So,
Do you need us to move it, Jess, or?
I think if I just join you here at the table, does that work? I joined Zoom, so I just need to share my screen.
so I serve on the Olympic Regional Clean Air Authority Board. This is our director, this is the staff over here. Absolutely wonderful people. They asked if they can come and speak to us and give an update on what they are, who they are, what they're doing, and a few other things, and that's why they're here today. And this is Jeff. He's the fearless leader.
Great, well, thank you, Randy, and I really appreciate, let's see, go
So,
to slide view.
Rachel Imus from the tribe is on. Vladimir is environmental health.
Okay, that's the name I didn't recognize.
For sure. Yeah, we actually have a flag. I just happen to think that's cool for some weird reason.
Okay, well, again, thank you, Board, for the invitation to join you today. Again, my name is Jeff Johnston, the Executive Director of the Olympic Region Clean Air Agency. Always happy to be able to have the opportunity to talk about ORCA and the important work that we do. So I'm joined here by Dan Nelson, ORCA's Communications Manager, Odell Hadley, our Senior Monitoring Specialist, and Mike Schultz, Compliance Manager. And we're just gonna quickly kind of tag team. I know we've got just a limited time on the agenda, but just wanted to kind of give you an overview of ORCA and the work that we do. If you have questions, by all means ask, or hopefully there'll be a few minutes at the end where we can take some more questions. So, again, ORCA is not, I mean, we're not public health experts, but we certainly have a public health mission. And so work closely with public health agencies throughout our jurisdiction. And speaking of our jurisdiction, let me go to the next slide. So who we are, we're a local government agency. We're a special purpose district. With a mission to protect air quality in our 6-county jurisdiction. So in addition to Mason County, we've got Thurston County, Pacific, Grays Harbor, Jefferson, and Clallam counties. In 1967, the Washington Clean Air Act came into force and gave counties the authority to come together to form clean air agencies, either as individual counties. There are some local air agencies that are single counties and others that are multiple counties. So in 1968, this Mason County joined with the other 5 counties to form ORCA. At that point, it was the Olympic
Air Pollution
Control Authority.
OAPCA. So we transitioned to become ORCA in, I think, the early 2000s. So, and we are one of 7 local air agencies in Washington. And we have essentially 4 main areas of focus of our work. We permit what are called stationary sources of air pollution. These are businesses that either emit or have the potential to emit air pollution. So, and we've got a registration program, Mike will talk a little bit about that, and a permitting program. So that's one aspect of what we do. We also enforce local, state, and federal clean air regulations. We monitor air quality. Odell will talk about that. We've got monitors in each of our 6 counties for the pollutants that we're most concerned about. And then we also educate the public about air quality issues. So in doing this work, partnership is critical. We're an agency of 18 staff operating out of an office in Olympia and over 8,000 square miles. And so the corner up there at the far northwest corner, Nia Bay, got a monitoring station up there that Odell operates with the Makah tribe. It's about a 4.5 to 5 hour drive from Olympia. So again, a big area to cover. So partnerships are important. Partnerships with local health jurisdictions, with fire districts, with permitting departments in the counties and the cities. And so one of the reasons why we're here today is to get the word out about us, but also to look for ways of strengthening our partnerships. So let's see then. So the next slide, I won't talk about Mason County. I'm assuming you all probably know a lot more about Mason County than we do, but the impetus for these presentations at the ORCA board meetings, we've been focusing on a county every other month or so. We had a focus on Jefferson County earlier this fall, earlier this winter. We focused on Mason County at I think our March meeting, and so this slide was an opportunity to inform the rest of the board members a little bit about Mason County. Randy, is there anything else that you'd like to highlight for your group?
Get down with your bad self, you got this.
Then this next slide, again, in the interest of time, I wasn't going to talk a lot about this, but Dan has been doing some really good work with the Shelton School District, getting out talking to high school classes. He's also done some wildfire smoke event work as well. So if there are any questions about that, maybe once Dan gets up here, you could ask him about that work. These are examples of some thank you notes that he got from some of the students that he talked to. All right, so with that, I think I'm going to hand it over to Odell to talk a little bit about our efforts to monitor air quality in Mason County and other places.
Oh, we're moving.
Yes, yes, it's musical chairs.
All right, so I manage our air monitoring program, and so Shelton, I put together a couple slides highlighting the history of air monitoring in Shelton. Starting in 1970, it was pretty crude monitoring. We did total suspended particulate, which is any particles large enough to stay in the air, and then particle and sulfate fallout, which is basically we put out these collection sheets that I'm showing you over here. and they show you, they're round drums, and they have a direction on them, and it shows you where the particles. So these are actually from Grace Harbor. They were the only examples I could find collected in 1970. But I just wanted to highlight that was one location. You can see that most of the fallout is coming from the west. And then a different type of source you can see is from sawmills, sawdust more than this black stuff, which is probably some kind of burning or soot or something like that. So pretty crude. And then they would collect this and weigh it, and that was how we got those measurements. So technology has really improved since then. So we've been monitoring in Shelton since the 70s and through the 80s. City Hall, PUD, first in CODA for total suspended particulate. And then in 2001, we moved to Mason General Hospital, where we started monitoring PM 2.5. And then in 2011, we moved right downtown, just a couple blocks away at the Shelton Fire Station, where we've had our PM 2.5 since then. And then in 2019 through 2020, we did a saturation study where we put out air sensors. They're little, about the size of a coffee cup, purple air sensors, to evaluate the location of our current monitor here in Shelton and to see if it really did represent the whole county for air quality. And this was the basic results of that study. So you can see we had one up in Belfair at North Mason Fire, one in the Timber Lakes Community Center. We had a lot of complaints from wood stoves and smoke in that community. Central Mason Fire, that is where the current monitor is right now. And at Bordeaux Elementary up on the hill. And then these results are shown in AQI colors where greens are good, yellows are moderate, and then dark orange is unhealthy for sensitive groups. And you can see that the monitor there up at the top, which is our reference monitor, really did represent pretty well the other county-wide monitors, and we weren't seeing anything too crazy at the other sites that our current monitor wasn't picking up. So we decided to keep it there at the fire station. And then here's 24 years of Mason County daily air quality. So I gave you a few sites to get you used to this, but now here is 24 years of data collected. Of course, in 2011 we moved, so it's not completely apples to apples, but the main features here are that your worst air quality, as most of our counties, is experienced in the winter months. That's largely due to wood stoves, and in the fall, a little outdoor burning. And then if you look down further toward the bottom, and that's more recent, you'll see some reds and purples popping up, and that is due to the increase in wildfire smoke that we are starting to see in the region in the summer.
You still left off the microns.
Oh, well, this.
Sorry.
That's a comment that Pat made to Odell back when.
Right, and I actually can't see this on my screen, and I'm having a hard time seeing under there, but I think that after you made that comment, I made the effort to go through and change all of those to microns, because I didn't want to get called out again, but
Sorry.
I clearly forgot this slide. I'm using U's in place of micro Greek symbol, and he didn't like it as an engineer. He was like,
Such a nerd.
I know. And so I am gonna now turn it over to Dan to talk about wood stoves.
So as was mentioned, smoke is a big issue for us. Smoke is typically our number one or number two source of pollution that we're concerned about. Number one is frequently mobile sources, which we have no authority over. Smoke is the number one source of particulate matter, and as you saw from Odell's slides, during the winter months, when people are burning in their wood stoves, that's when we usually see the more elevated pollutant levels. So indoor burning of wood stoves is a big issue for us. We do have a grant from the state that 6 years ago we were able to, or 5 years ago, able to expand it out of Thurston County to more of our counties. And we were able to implement the wood stove change out program in Shelton and the Shelton UGA, urban growth area. And then this last cycle, we were able to expand it to all of Mason County. So we can provide And that runs out this biennium, or this fiscal year, and we should have a new one in place by early autumn. From the state did get the grant money through the legislature, and so we'll renew that hopefully by September. But basically, it's a way to provide some financial incentive for people to get rid of their old uncertified wood stoves and replace them with cleaner home heating system, whether it's a new modern certified wood stove, or what we prefer, give higher incentives if they put in ductless heat pumps or even natural gas or pellet stoves, something that really cuts out that particulate matter pollutant. So I will note, I've been looking at the history of our program. Since 2011 when we started, region-wide we've done 971 stove replacements or removals. And that equates to just over 75 tons of particulate matter per year removed from the air. So, and in Mason County, we've done 40 or 50 stove replacements. And we've seen a reduction in wood stove use in Mason County, according to the US Census data from 2011 to 23 of about a 3% drop in homes with wood as a primary or secondary heat source. So that's kind of mirrors, the state average is dropping by 1% of wood stove use. So we're seeing a little higher incidence of reduction of wood stove use in a pretty heavy timber county. So there's a lot of factors that, but we like to think that our program has some impact on that as well. The other issues of concern, again, are the wildfire events, as Adele mentioned. We've done a lot of education on that. I've been in the high school classes. We work with the local fire districts on some of the wildfire ready neighbors and the DNR programs that have been going on. And then again, if we can work with the health departments and get out and share that information of if you have smoke events, what are the best practices? Stay safe. Unfortunately, usually we see these smoke events during high heat events too, so there's dual, I mean, we're telling people, don't go outdoors, close your windows when it's 90 degrees or 100 degrees, so there's sort of a lot we can partner with and figure out how to make it work for the best health of people, both from the smoke and heat events. And then outdoor burning. Outdoor burning is another big issue and source of smoke, but I'm gonna let Mike talk about that.
So how do you know if your stove is certified?
Basically, there should be a tag on it. Our program now allows any stove that's pre-2020 certified. So if you have a stove from the mid-2000s or earlier, it's probably not going to meet that 2020 certification standard. Modern stoves, I like to tell people, modern wood stoves are no longer the iron boxes with some fire bricks in them. They're very complex. In fact, one of the biggest complaints we get is people buy a new stove and they didn't take the time to learn how to operate it because there's reburners in it and multiple air chambers. So you're getting a more complete combustion of the wood instead of just loading up a box with as much wood as you can and torching it off. So there's a lot of technology involved that will cut the amount of smoke by an order of magnitude from a wood stove.
And you can go to our website and we have a link, and Ecology maintains a list of certified stoves through manufacturers, so you can go to that and see what's been tested and approved as a certified stove. Give you some idea that way of what's there. Okay, outdoor burning. Mason County is unique in our 6-county area in that we've got a memorandum of agreement with, or it might be of understanding, we've switched them back and forth, but with the fire marshal, as at least the commissioners probably know, and Randy Collins, he's doing a great job. So we utilize the fire departments and the fire marshal a lot with our burn program. The agreement is that they will write the land clearing burn permits, so the big burns, anything over legally 4 feet should be a land clearing burn. They will issue the land clearing burn permits, and they also then do investigation for us. We still come up here and investigate, because Randy can't do it all. If there's a way we can we partnered with the fire departments as much as possible and Randy, but we can't do it all, so, and neither can they. So we try to help each other out. We maintain the enforcement, so if somebody needed a violation notice, we could take the fire department's information or the fire marshal's information, and we could write enforcement tickets on that. But we spend a lot of time in the 5 other counties and some time in this county with fire enforcement, but the agreement's really good that he helps us out, because as Jeff said, we gotta cover 6 regions. So, and that agreement's been in place since the days where you guys had a fire marshal and 2 wardens, because I remember that back in 05 and 06 and 07. And so then they really covered well. It's kind of been depleted there since. So, again, fire marshal, fire lists their own permits. We do enforcement. The other thing we do that people don't realize, asbestos is considered federally as an air emission. So we regulate the asbestos emissions. And in that, we have an asbestos program that ties into the demolition program. This is where we can work really good with your building department. Because if people are getting a demolition permit through your county or maybe a remodel permit, they are not only with us, but L&I, federally, there's a lot of rules that govern asbestos. They should be doing an asbestos survey. And with that survey, then if they have asbestos, there's permits they need through us. And they also need a demo permit with us, even if they don't have asbestos, because we want to see the asbestos survey. We have people on staff that are certified as people who can sample and read those surveys. We don't sample, I don't want people to know, but we've got that expertise to look at and see. So anything we can work on with the demo and renovation stuff with the building department is always good. Roughly about 30 demo permits last year and about the same asbestos, roughly. And I know there's more remodels, and so I guess that's my big soapbox here, is that there are people out there remodeling, and it's not just Mason County, it's everywhere, that we don't know about or doing demos, especially on a small building they can knock down on a weekend, that perhaps can have asbestos, because they usually aren't knocking down newer buildings, they're knocking down older buildings. And if we can help with that, if we get help with that, we can make sure that people aren't getting exposed to asbestos through our asbestos program. And I'm happy to talk to the individual departments later on at a certain point. We've talked to a lot of people over the years. Dan's made some great brochures and stuff that help explain it, but yeah, so that's another part that compliance does. We also are tasked with inspecting all the businesses that will be emitters or potential emitters, anywhere from a gas station to crematory, composters, wood industry, paint shops. Basically, if it's got some VOCs or emitters, as you can see by the slide, there's 67 sources in Mason County. There's one major source, that's downtown, used to be Simpson, now it's Sierra Pacific. And the major source has a bunch of federal rules that are a lot tighter. We can do a lot bigger inspection there than we do with the smaller sources. 59 inspections in 2024. Basically, what we will do of those 67, based on how large they are, we will do a lot of the big ones once a year. Smaller gas stations, paint booths, we'll inspect every other year. Or if we get complaints or whatever, we'll go out and inspect. Then we gather the emission inventory. So the top 11 emitters, we ask them to give us their emissions for the year and what they are putting out in the air. And then we gather all that from the whole region, and we send it to ecology, and they gather it for the state, and they send it to EPA. So there's definitely a database of a whole lot of emissions over the years, and we have to do that for top 11 emitters in this county. Total region-wide, we do about 80 emitters that we collect the data from. So we're out there with compliance doing inspection on asbestos and demos, outdoor burns, wood stove smokes. There's some areas in Brennan, there's some area in Lilliwatt that we get wood stove complaints quite a bit. We're working some Hamma area, wood stove complaints, so we would work with those complaints, try to get people to burn correctly or get a new stove. So we do that, and then our engineers are writing permits for the businesses, so there's definitely some federal and state rules and ORCA rules that they write the permits on. They would issue those permits, and then that's what the people build and or operate under. And we go out there to ensure that the control devices, it can be as little as a gasket on something, or it can be a bag house or a ESP, so it can rent a paint booth, make sure they're operating correctly. If they're not, then, you know, there's a problem, we'll work with them to correct it. As part of that, we went to the Pacific Coast Pellet Mill up there off of Johns Prairie Road. It used to be Atlas years ago, I think they changed. And you can see one of your fearless leaders up there with the orange vest, Randy up there. But we went up there to do a little inspection for our inspectors, but also we're going to different businesses in each of the county to let our board and the boards in that county know what we're looking for. And in this case, they have bag houses, cyclones, a rotary dryer. So we went up there, and as you can see, there's Randy in there, our attorney's in there, because we have a big case in Grace Harbor about a big pellet mill. Ray McLeod, I don't know if you guys know him, but he's the one in the blue coat. Mark Ziegler got his back to us. The one with the yellow is our engineer, because every facility will have an engineer that works with them also with the, again, control device. The one with the clipboard with the blue coat and brown hat, that's gonna be the inspector, and then our fearless leader, Jeff, is on the other side of the guy with the yellow coat on the left-hand side there. So normally we'd only take an inspector and or an engineer, but in this case we brought the whole gang to show them what, again, it's just a way to let them know what's going on. And I think Randy could attest to you, this is the fun part of the job for the inspectors, because it's like being part of the show, how it's made. You get to go out and see all kinds of stuff, all kinds of neat things that you wouldn't even think about, you know. So that's the cool part. The sad part is, you know, going out to, the other thing I want to mention, because I want to give Ian some props, Ian Tracy props. We work with him. He's got solid waste issues and stuff that, of course, they burn a lot of those things. So we work with him. It's an every 2-week meeting. I used to be on it, but now I've passed that off. That he's done a real good job reaching out to us to say, hey, can we coordinate some of these? Because a lot of the houseless areas, the solid waste areas also burn illegal, the stuff, you know, the plastics and the stuff. So we can work together. We'll have more punch that way. So we could work with him on that way. So we work with a lot of your departments. Because a lot of what they're doing here affects our rules too, and what we want them to do will make cleaner air in the areas you're at. So again, Ian, props to you. He's really good about reaching out, and we work with him. We join the meeting when we have some issues that we gotta go out. There's one way out Hairston Island or something I think we've been working on for a while, and it's, if they've got a problem, or if we got a problem with burning illegal plastics and garbage, usually Mason County's got the same problem. That's a quick little rundown. Any questions, comments?
I guess questions for any of us. We've got our contact information here. I can share these slides with Dave and Mackenzie so that you've got them.
And if I can, I'll let you, when I first joined this board, I didn't do it since I first came in. I went afterwards, I think it was Commissioner Jeffries that became Drexler. After she was done, I came in. When I first went in there, I thought for sure we're gonna be on opposite sides, because I'm not a big fan of administrative law or non-electeds doing this stuff, but they weren't like that. First, they're very conservative with their money, their numbers were always good. Second, they didn't use fines and regulations to try and put people into their place. Instead, since I've been there, we've had one big giant fine, and I was really worried we were using it to bring in revenue because it was huge. It was, what was that large?
It was about 1.9 million.
Yeah, which is huge. And I thought for sure, I'm really worried about, they called me and said, Randy, don't be upset at them. It was a calculated decision that they were making to offset what they were doing while they waited to decide to make the changes that they did. And it was a huge company. And they were proud of how they negotiated with them, because it could have been a lot larger, but they chose not to. And so you want to give them the props for that. Again, they don't let the political stuff, and it comes close a few times where we have some discussions in there, but when it's all over with, they don't use the political things, at least at my level at all in there, and I'm very proud of that with them. I found them to be very honorable and good to work with.
Thank you. We try, you know, unfortunately, the compliance division, the engineers and the inspectors have the unfortunate task to find people. And that's never easy. We try not to, but there are certain things that get fined, especially if it deals with emissions that aren't being done or tests that aren't being done. But we do people know those and remember those, but there's a whole lot of, you saw where there were 67 here, there's 800 sources roughly in our 6 areas, and so you may get, 20 or 30 violations of those 800. So, there's a lot of them we're working with, a lot of them, we want to, just do the right thing, because usually we don't drive around looking for stuff, it's usually complaints from citizens and whatnot that get us out to the outdoor burning, the asbestos stuff. Now, the registered sources, like I mentioned, we go out to them and hope they stay in compliance, but, and we do unfortunately have to issue tickets at times.
And really quickly, I forgot to mention that through Ecology, we're gonna be placing additional permanent sensors in each of our counties. We have already been working with Chief Cooper at North Mason Fire District to place one in Belfair, and so that will show up on the air monitoring map for the state and our website. We have another one, we will probably, maybe toward the end of this year or early next year, be placing in Mason County. We haven't chosen that location yet, so if any of you have communities or neighborhoods or you feel like it, please reach out and let us know. So we want you guys to have input into that placement as well. If you don't, then we'll pick it for you. But if you want to let Randy know or pass that information on to Randy, he can give it to us at a meeting. So sorry about that.
And we didn't talk about our website, but orcaa.org has lots of information about all of our programs, lots of information about the business assistance programs, our monitoring information, other things. So please check out our website.
So you mentioned Lily Wop and Brennan, and those areas. I go up there quite a bit, that's my district, so what is the relief some of these people could get if they were to upgrade? Is there?
With the wood stove complaints, I'm thinking you're referring to.
Yeah.
We try to educate them on proper ways to burn. I don't know if we still have them. We used to have moisture meters we can hand out to them, make sure the wood is dry before they burn it, don't overstack it. There's a lot of things they can do to hopefully modify their wood stove, because even if it's an uncertified one, you can still burn clean, you just gotta be very careful how you do it. If they're not and they're impacting the neighborhood, it takes us a while, because we gotta be there to see it before we do any enforcement, if we have to go that far. We try to educate and educate, because people are trying to warm their house. But ultimately, if it gets to the point of we have to do something, we would encourage them first to talk to Dan, and we've had some, I think, up here that have, some of those ones he said complaints, to get a certified stove or a pellet stove, which will burn cleaner, and take the other one out, and we take that into consideration. Even if they get a violation, we'll take that into consideration to soften the violation if they switch out. But they only here have the rebate or
no. So if you're asking what incentives, so the basic program as it stands now, there may be some small variations in the next one, but if they just want to pull out the wood stove and recycle it, do nothing else, it's a $500 recycling award. They can use that $500 to buy a new wood stove, to go out to dinner, to go to Hawaii, or a third of the way to Hawaii. If they want to replace it with a pellet stove, the program provides a $1,000 grant. If they want to provide, or pellet stove, natural gas, propane, or an electric fireplace, they can get $1,000. If they want to put in an electric heat pump, ducted or ductless, we'll give them $2,000.
So we really encourage that on any of the wood stoves. That's the first thing we get a complaint. Hey, this might be old, there's ways to burn, but we have this great program if you want to take part in it.
And I will note, I work closely as the communications manager, work closely with the inspectors and the compliance team. For the entire time I've been with Orca, 21 years, the management, the board has been really supportive of the idea. We want clean air, we want to change behavior. If we can do that through education and outreach, that's our first step. So that's, if we're not looking to make money through fines, we want to change behavior. And so if the best way to do that is through education and outreach, we're going to push that as much as we can. If that fails, then we'll go to fines. So I know just this spring or winter, we had cases where there was complaints against somebody burning way too wet wood, dirty wood. lot of smoke out of their fireplace or their wood stove. Compliance worked with me, we got that homeowner to pull that stove out, I gave her $500. The neighbors were all happy, and that low-income household got rid of that dirty wood stove.
So are the incentives income-based?
No, so we
So
will
period,
have.
if any of us pulls out our stove, we can apply to you and get $500.
If you meet the criteria, yeah, so it's an uncertified wood stove burning at least a quart of wood a year. We
I think
will
probably
be.
90% of the stoves out there are uncertified based on the years you're
Most of
talking
them
about.
are, yeah. So, we will be looking at, in the next cycle, of doing more of a income qualified program too, where we can provide higher level incentives. We're working with a few different programs, and if there's, I know in Jefferson County, we're working with Jefferson PUD. In Thurston, it's Energize Thurston, in coordination with Habitat for Humanity to do some of these income qualified places. So maybe Mason PUD, or if you have programs that can identify the income qualified households that would qualify for or would benefit from a higher level of incentive, I'd love to talk to whoever is appropriate at the county level.
Because was it PUD or somebody was offering low-income heating pumps and everything else for families?
Yeah.
So if you combine that, can you combine that?
Yes,
with what
yeah,
you're doing?
that's
I was
what we'd
gonna
like
say,
to
I've
do, is
heard-
I'd like to stack, and that's what I tell people, people are worried about, well, if I use yours, do I have to reject the other?
Yeah, that would
And I
be-
say stack
That would
them
be a
up
selling
and-
point to be able to go to them and
Yes.
say, PUD will give you thousands of dollars towards this, and
I've heard
And
stories
that's-
of some
yeah.
people who have had it almost paid for for a smaller
Yeah.
unit, if they pull out the wood stove and they're getting a smaller ductless heat pump and they get a big PUD break and then they get an Orca break, and yeah, so it can really add up.
Well, the PUD rate is based on your electricity, so if you've got baseboard heats, they're giving you $6,000 to upgrade to a split unit right now, and that almost pays for it to the dollar.
Yeah, and see, then if you had a wood stove you wanted to get rid of at the same
And
time,
then-
we would give
yeah.
you the.
Yeah, I was gonna say, I have a lady who was in her 80s. I just went and visited to help her with a situation. She showed me her brand new unit that she got. The only thing she had to pay was $400 because there's certain parts that you have to cover yourself. This kind of covered that, but she got it done.
Yeah. So there's a lot we can do, and again, if there's program, I know I've worked with Mason PUD in the past, and I'll be in touch with them. We just got some notice about the new grant cycle, so as that develops, we'll make sure we have Mason PUD and the county roped in.
Thank you, guys.
Awesome.
Okay, well, thank you again for your time, and please, if there's any other follow-up questions, or you can think about
That one,
other
yeah.
important, just important
Granny can
linkages or
apply.
partnerships,
Right,
please,
so my
please
son's
let us
trying to
know.
apply.
Yeah, and on the education and outreach end, if there's groups that you would like Orca to come to, I know I've been up here and spoken to the Rotary Club and the Lions, I know I've had us out in the past.
And I wanna say the same thing for environmental health, if we would speak to, or the building department, cause we'll come out and speak to them specifically about, more in depth about the asbestos and programs if you want, just let us know, and we're happy to do that.
We'll mention to our building, we have Josh that goes out to the meetings with the builders and see if we put something together.
Excellent, thanks.
You know,
Thanks, guys.
just a thought process here before you get out of here. If you wanted to really push that through the county and city around here, if you had some kind of thing that the councils and the commissions could push at the meetings and just hand out at the front counter when people come in, that would probably be
Are you talking in general or wood stove?
wood stove.
Yeah. I think we can
Yeah.
probably get some of that stuff.
Just some kind of flyer or something like that that
Yeah.
you could set at front counters or in the commission meetings or the city council meetings that they could push this.
Yeah, we've had that, and, you know, I don't have the wood stove examples, but, I mean, that's the kind of thing I've done for cutting campfire smoke in the
Yeah,
summer
just something
months, so.
basic like that you could put,
Yeah.
yeah, that would be probably helpful.
Okay, no, that's great, cause yeah, but people need to use it, 'cause if he gets people to do it, it helps the compliance team not have so many complaints. So, yeah, it works good all the way around.
Thank you.
Awesome.
Thanks.
Thanks. Thanks for inviting me. I think there's a lot of little places around where you talked about that are 1-2 bedroom places out there that
you could get paid for.
Yep.
Especially if they piggyback.
Yeah, that's what I mean, yeah.
Yeah.
Dr. Krager, you on with us?
I am. I apologize for being a little bit late. How are you all?
We'll send you the fine in the mail. We're gonna go back to item number 4, if you wanna give us your report.
Yes, thank you so much. I'm gonna share my screen real quick.
I got, believe it or not, caught up in another board meeting. Okay, I hope you can all see that okay. I have just a couple quick slides. I know you're all at the end of the meeting, so I don't want to hold you too long. I wanted to just highlight what we call vector-borne diseases, or sometimes animal-borne diseases in Washington. So the most common being mosquito and tick-borne. We have seen some hantavirus recently, and that's also been in the news. I wanted to touch
on that. So going through mosquitoes, two of the two biggest mosquito-borne diseases that we think about in Washington are West Nile and then St. Louis encephalitis. Thankfully, this is over the last few years, we haven't had very much West Nile, which has been great. I don't know the reason behind that, but we haven't had as many human West Nile cases. The state still does, and various mosquito control districts across the state do, look for West Nile in mosquitoes, and will notify places if there's a mosquito that has been found to have it. West Nile is kind of interesting. Most people who are infected with West Nile do fine, but about 1 in 150 have really severe brain inflammation called encephalitis as well. So thankfully, not as much recently, and we'll see what happens with West Nile. The other big one is tick-borne diseases. We had an interesting tick-borne disease in Mason County last year called anaplasmosis, which is pretty rare. I have some of the data around that, but it is tick-borne. It's transmitted by this western black-legged tick, and which is one of the most common ones we have in the area. We have probably the second most common is the soft tick. We do have some American dog ticks and Rocky Mountain wood ticks, but they're a lot more rare. And these obviously aren't all the ticks that we have, but these are the ones that are most important in terms of disease transmission. This western black-legged tick also transmits Lyme disease. We don't have as much Lyme compared to other parts of the country, but we do see transmission every once in a while. These are some of the other kind of more common tick-borne diseases that we see across the country, and I point this out, these dots are kind of cases of ehrlichiosis, Lyme disease, Rocky Mountain spotted fever. Funny that it's called, I always like to point this out, it's hardly in the Rockies at all, but I don't know, it got named to that. Tularemia. So again, on the West Coast, we actually do pretty good. There's definitely some Rocky Mountain spotted fever, there is some Lyme, there is some tularemia, but compared to other parts of the country, Midwest and East Coast, upper Midwest, East Coast, lower Midwest and East Coast have things a lot worse than we do. So we see transmission, it's not terrible, but it is important to keep in mind, especially as people hike, go camping. I just went on a hike this weekend, and I had prepared these slides, and I was like, why did I not wear long sleeve pants? I'm like going through the underbrush, I'm like, I'm gonna get a tick-borne disease, and then I'll be a hypocrite. So these again are some of the tick-borne diseases that we see across the state. I just wanted to kind of look at this 10-year trend, and again, we're talking about a handful of cases a year. Soft tick relapsing fever, which is interesting. It's like you kind of get fevers for a couple of days and then it goes away and then you get fevers again. Thankfully more on the east side of the state than on the west. And that's our most common. Lyme disease we kind of see more on the west side, but really only 0 to 7 cases. More of the cases we get of Lyme disease are actually travel related. So someone went to, the East Coast, did some hiking and come back and then gets diagnosed. I mentioned anaplasmosis. I don't have this data because the report isn't out yet. I should have still put it here, but Mason County did have one case last year.
And let's see, tularemia, sometimes also transmitted by rabbits. So yeah, I just wanted to go over kind of the bigger ones. Rocky Mountain spotted fever, not a lot. Thankfully, not much local transmission, but we do see some travel because associated. And these are all total cases across Washington, I want to point out, not just Mason County. All right, this is probably the most important slide. How do we keep, safe from ticks and mosquitoes? Standing water, especially, around this time of year, this is when mosquitoes love to start reproducing. And, I have a little pond and I can see the larva growing. I need to put something in to kill it. When you're hiking long sleeves, some sort of repellent, there's various ones that work well and have been studied. And then obviously at night, that's when they like to come out. So, intact door screens, window screens, that sort of thing. Similar with tick-borne diseases, we want to look at long sleeve clothing, some repellent. Think about doing a tick check, especially if you've been brushing up against things while you're hiking. Keeping your cats and dogs on tick prevention. Hantavirus, we saw one death in Whitman County this last year, and it's usually from deer mice droppings. Deer mice are very common, and they like, sheds, they like garages, they like barns, places they'll be a little bit less disturbed. So encourage people, if you find, what looks like evidence of droppings or a nest, or you've trapped some mice, being careful with those droppings when you clean them. Obviously keeping them out is best, but that's not always possible. But you can spray them with spray the droppings with like a bleach solution that keeps the dust from getting up as you're cleaning. Do not vacuum, because that will also kind of kick up dust. So like wet it first and then sweep it up, and that will prevent that. Hopefully that hantavirus from getting into the air. Those were the topics that was what I wanted to talk about today. I'm happy to talk about anything else, or if there's any questions, but I know, again, I think we're kind of already over time.
Making us all itch sitting here.
What was that?
You're making us all itch talking about mosquitoes and ticks.
I know.
My lesson learned is under the tick one, don't go hiking. I'm good with that.
I was just curious about the blood-sucking rabbits.
Which cycle? What was that? Sorry, I'm apologizing.
The blood-sucking rabbits.
Oh, yeah, so I should have been a little bit more clear. It's actually.
He understood.
Actually, the rabbits are not rabid, and they don't often bite us. But tularemia, so it's tough because it can be tick-borne, but it also can be just from rabbit urine and exposure to that. So it's kind of a double whammy. But yeah, but let us know if you get bit by a rabbit. We do want to know that.
Yo. Thank you, Doctor.
Thank you.
Okay, item 9, other business and board discussion. Any comments, discussions, questions otherwise?
Is there any update on the Happy Garden at all? Just curious.
Happy Garden is still, they're working. They had some challenges with what they decided to do that was not consistent with the instructions they were given, so.
That doesn't surprise me, actually, but hopefully they will listen and follow what you're saying eventually.
It's been interesting, the community feedback on that, of how dare we. I wish we could have taken them on a tour of the back of that place.
I showed a few pictures.
I was gonna say, I think we did well with them, but it's up to them.
Yeah.
I think that's what we all came away with.
It's your responsibility.
We did our job and our staff did theirs, and now it's up to them to meet the two. And until then, what can we do?
Yeah, we took the letter from the board, which was your decision, as well as a guidance sheet, and had both of those translated into Mandarin Chinese, and then provided both of those documents to them. And then they did their own thing.
You can only get them so far. Okay, seeing no comments, no public, adjourn the meeting. Looks like what, 11:21?
12.
12:21, sorry.
I was gonna say, I'm missing something.
I lost an hour.
One of my first jobs in public health was tick surveys.